So there are studies that show that women who exercise, they actually have shorter labors and shorter pushing times.
Most people think of exercise during pregnancy as just a way to stay healthy or keep your energy up, but here's what most women don't realize. Staying active can actually have a big impact on how your labor goes. The right kinds of exercise can make birth easier, reduce the risk of complications, and even make giving birth less painful. So in this video, we're going to break down which types of exercise are safe, what to avoid, and how staying active can help you prepare for a smoother, more comfortable birth. Hello, I am Rachel Moises from the Mighty Mama Movement. I am a mother of 8, and I am here with Heather Shelley.
I'm Heather, and I am a family nurse practitioner, a licensed midwife, and a board-certified lactation consultant.
You may know that we here at the Mighty Mama Movement have a free online birth course called How to Give Birth with Practically No Pain. That's our specialty, is how to have a low pain, comfortable, enjoyable birth. So if that's something that interests you, we will put a link in the video. Be sure to click on that and join the free class. In the meantime, let's talk about why exercise matters in pregnancy. So exercise, as we just said, isn't just for fitness. It does have an impact on labor and delivery. Can you help us understand partly why that is?
I think a lot of it is labor is called labor for a reason. It's laborious. There is a lot to do, and having that endurance can really make a difference on you progressing through labor and being able to relax. I like to think of running. I tell people labor is a marathon, and you wouldn't wake up one morning and go, I think I'll run a marathon today. Yeah, this is going to be good. You wouldn't be very successful in it. You could do it. It might take you a very long time and you would be in a lot of pain. But the more that you prepare for that marathon, the more that you exercise and train and get your muscles, but your mind as well is a really big one. And that's what we talk about in our classes is the mind, and exercising in pregnancy keeps our body healthy. It keeps our mind healthy.
Okay. I love that analogy. Preparing for labor. Labor is a physical thing and very physically demanding. So the healthier you are, the more fit you are, naturally, the easier that it's going to be to have a smooth labor.
And we found that moms, because they know the endurance side, that mental side, for instance, women that do yoga, we find do quite well in labor because they're used to meditating. They're used to being in uncomfortable positions, kind of doing those stretches with the body, but they're used to breathing through it and working through it. So when moms say, what are some of the really good things I can do? I love yoga.
Okay. I can understand what you're saying there. I do not love yoga,
Well,
but I don't do it.
But
I do
I've seen good results.
I do exercise, and I very much understand the concept that a lot of it is a mental game, right?
Exactly.
And being, I strength train mostly, and so much of it is how my mental game is that day, how hard I can push myself. It's not nearly as much how my physical body is doing that day, but whether or not my mind's in the game, and I'm just kind of like, nope, that's enough. I'm done for the day, or like I'm just ready to go and I can keep pushing. So I love the idea of getting used to having your mind sort of get your body to do what you need it to do.
So there are studies that show that women who exercise and stay in physical fitness shape, a good shape, they actually have shorter labors and shorter pushing times as well. I found that women who are used to that physical labor, whether it's exercising or let's just say working on a farm, for instance, they are used to that endurance. They have better hearts physically. Their bodies are used to that long work, but also their minds. And that's a big one, is someone who, let's say, sits all day at a desk job and doesn't get a lot of exercise, doesn't do a lot of walking. They're typically going to have a more difficult labor mentally and physically than somebody who is constantly active and is used to pushing those limits.
Okay, and most people are not constantly active. Right. I'm certainly not. The only way I get exercise is if I set aside time in the day and I intentionally do it. And it's actually really shocking how few steps I get in a day. I don't use a Fitbit or like a step tracker, but I started looking on my phone to just kind of see, and I couldn't believe some days how few steps I took, how little I even moved my body at all, if I'm not intentionally doing that. And it can be even worse in pregnancy because you don't feel like moving.
Right.
You don't feel too well. Once you start getting heavy and big, it's like, I don't want to move my body at all. So let's talk about, okay, in pregnancy, what can you do for exercise that's safe, or are there things that you should avoid while you're pregnant because you do have the whole fact that you're pregnant?
Right. Well, let's start with the extreme ones. You shouldn't do skydiving. You shouldn't do deep sea diving. Snorkeling is fine, but anything with those extremes. Okay, so we'll take those ones out of the picture for you. Balance. You need to be careful with balance because your center of balance changes. And so things that may be more risky dealing with balance, like let's say climbing up the side of a mountain, be careful with those things. And then the next thing you need to look at is, what are you normally doing? If you have been training for marathons, you're fine running a marathon in pregnancy most of the time. I had a woman come in once, she was about 35 weeks, 36 weeks. And I said, how are you doing? And she said, well, I think I've run my last 5K. And I'm like, you've been running I don't even run around the block. Like, you're running a 5K. She goes, well, I was running marathons. And then around, 24 weeks, I went to half marathons and then 10Ks. And I just ran a marathon or a 5K. And I think I'm done. And I was like, awesome. That is great. But if she would have said, I think I'm going to take up marathon running, I would have been like, no. Bowling is a good example. If you're a regular bowler, you're fine to bowl throughout your pregnancy, but you shouldn't think to yourself, I think I'm going to take up bowling now that I'm pregnant. That is not something you should do. So you can do many things. There have been many marathon runners that are 8-9 months pregnant. Just don't start that when you're pregnant. Same with yoga we were talking about. I wouldn't go into extreme yoga when you're first pregnant. You would have to start very low, very basic, and not do, the really hot yoga, those sort of things. Just anything at all. Weightlifting, you can continue to weightlift. You have to shift how you weightlift. You wouldn't want to exercise those core muscles because your rectus diastasis is spreading as the uterus pushes up. But that doesn't mean you have to stop weightlifting because you're pregnant. You just have to change it. And for heaven's sake, don't start weightlifting for the first time when you're pregnant.
So what kind of things can you start if you're like, well, I actually don't do any exercise, but I'm understanding that I should. So what are the types of things that you could pick up during pregnancy?
Definitely walking is a good one. And really, you could start with very low resistance training. I don't think I would do weightlifting, but resistance training you can do. The other thing is, don't do no pain, no gain. We do that a lot. We'll say, okay, no pain, no gain. Push through the burn, push through the fire. When you're pregnant, you can't do that because you can injure yourself because of the relaxin hormone going through your body. You can dislocate joints easier, sprain your ankle easier, cause shoulder and knee issues. So you do need to listen to your body and not push your body to those limits.
Okay. So I want to talk about walking for a second. My own personal journey with walking.
Okay.
I look down upon walking. I have before. I guess it seems like such a lame type of exercise. Like, is that even exercise? Walking? Right. Sorry to all you walkers, but this is how I felt about it. And so what I was doing instead of walking, this is not when I was pregnant, but I was doing HIIT workouts most days and pushing myself and almost dying every time and feeling like, yes, I'm really, getting in fit by doing all this. And that's, fine if you're doing HIIT workouts. I'm not saying you shouldn't, but it turns out that at my age, doing HIIT workouts every day is not actually the best because it increases cortisol levels in your body and it's just very stressful on your body. And so the recommendation for women 35 and older is to keep that high intensity workouts to twice a week. Okay, so again, I haven't gotten to pregnancy yet here, but I heard that and I had gone through the research and I'd come across it multiple times, but I just kept thinking, yeah, right. I'm not old enough to have to be exchanging HIIT workouts. For walking, that's pathetic. I'm not that old yet. So I resisted. And then finally one day I just decided, you know what? Everyone keeps saying that walking's so good and there's all these benefits. I'm going to give it a try. And so I swapped out my HIIT workouts with walking. And interestingly enough, that is what it took for me to drop the last of my baby weight. I was several years postpartum and had come to terms with the fact that I would not drop those last few pounds because I was really doing everything right and wouldn't drop them. Okay, you're not trying to drop baby weight right now. You're pregnant. Embrace the baby weight. Don't worry about it. But the point that I'm making with this whole long story is that walking is very beneficial. And when you're pregnant or older, it is actually even better in many cases than intense exercise. So don't scoff at it and be like, oh, I'm not going to walk because that's pathetic. I'm a strong, healthy, pregnant woman. Like Heather said, if you're already doing more intense types of exercise, that's fine. But if you're thinking, well, I want to pick up something, but walking is just too lame, it's not enough, I encourage you to give it a try, and you might find that the benefits that are research-backed will be really good for you. Okay, so I've heard that exercise also, and walking especially, is good for baby positioning and oxygenation. Could you talk to us about that?
Definitely. So walking, exercising, all of that puts baby in a good position because of the way our posture is. When we lay back, recline, watching TV, driving in a car, sitting in an office chair, it puts our hammock, the uterus, reclining backwards. And so baby's going to go and turn that way because that's more comfortable. Nobody lays in a hammock like this, right? We lay in a hammock like this. But if we are up and exercising and moving and gardening, doing things that lean us forward, because leaning back is more leisure, relaxation. We're sitting upright and leaning forward. We're doing things. That makes the hammock of our uterus forward, and baby's going to get in a more ideal position. Plus, when we're walking, we're moving, baby is walking and moving its body with us, maybe not physically walking, but it's getting in those positions where if we are sedentary, baby is going to settle in positions that are more difficult to get out of because mom and baby work together. It's not separate. Baby isn't doing all the moving. Think of a ring. You don't just shove a ring on your finger and pull it off. You work it on, and especially if it's tight, you work it on, you work it off. And it's a movement of the ring and the movement of your hand. And that's kind of baby with mom, working together as a team in motion. And someone that's sedentary, baby's having to do all the movements by itself.
Right.
One of the advantages of working out is the hormones that are created from that. So we have endorphins, dopamine, serotonin. All of this help our mental health. And think of a rainy day, right? You're kind of sad. We're usually less sunshine. We're more dormant on rainy days, but on sunny days, we have the energy from the sun. Our moods improve. We are more active than when it's raining. And exercising helps our mental and our physical, and it releases those hormones like endorphins. And so our body is used to those endorphins, and endorphins make labor less painful.
Right. So our body is releasing them continually. And that's one thing that we talk about in the practically pain-free method, that during labor, you need to learn how to reduce those endorphins, and there's different ways to do that. But that's great. That is just getting that through pregnancy and getting yourself used to that. And then I wanted to talk about reduction of complications. So in another video, we talked about, for example, gestational diabetes, preeclampsia. Right. How does that, is there any relation between exercise and reducing general complications that could occur in pregnancy?
Well, definitely the more in shape your body is. If you have bad knees, it's going to be harder to walk around in labor and help get baby into those ideal positions because your feet hurt or your knees have been damaged because you haven't done exercise throughout your life. And that endurance part makes a really big difference. If you have gestational diabetes that wasn't controlled, you're going to have a larger baby. Everything ties in to it. It's exercise isn't just, oh, your heart or your muscles. It's just it's a little bit of everything.
Your overall well-being.
Exactly.
Okay, so exercise can reduce your risk for some of those
Definitely.
things if you're regularly doing it.
Yep. Definitely. And so, yeah, it's not just one thing. There are so many facets of it. Baby's position, your body, how it can handle endurance, your weight. I mean, think of it. Someone that weighs, let's say 150 pounds compared to someone of the same body height and stature that's 300, they're carrying around 150 pounds more. And that is hard on your joints. That is hard on your body. And when you're trying to go through labor or just anything in life, that can really make the difference. On the flip side, you have to look at the heart too. You can have two people that are very similar, but one doesn't have good heart endurance and the other person does.
So another benefit of exercising while you're pregnant is a faster recovery afterward. I don't think we even need to go into a lot of detail about that. It's pretty obvious that if you start out being healthy and then you go through a very demanding physical experience like giving birth, your body is going to bounce back and recover better afterward. Do you have anything to add about that, or I think that's pretty straightforward?
Yeah, pretty straightforward that for the most part, you're going to have that recovery. Your body won't feel like, oh, I've never done anything even close to this before.
Right, kind of like waking up and running a marathon without ever having trained for it.
Yep.
Okay, so we want to talk about some general safety guidelines for exercise. So Heather has already really talked about not pushing yourself too hard, not starting some new type of intense exercise. Anything you do start out new, easing your way into it. We just want to point out, if you're pregnant and you're starting anything new or doing anything different, you do want to check with your healthcare provider, because there are some situations in pregnancy that could make it so that you shouldn't be exercising or moving so much at all. We don't know your medical history, so we can't exactly tell you, it's safe to do any type of exercise. You would want to check for that. When we talk about exercising, we're really just saying 30, 45-minute walk a day or whatever. You don't need to go extreme. It's moderate exercise. So even with walking, we're not talking about necessarily speed walking, unless, like Heather said, you already are doing intense exercise. So moderate walking is basically just you could talk to someone comfortably while you're doing that. And then you want to talk to us a little bit about just listening to your body and how to know. You mentioned the marathon runner. She was aware of needing to reduce her running. For someone who isn't a marathon runner, how do they know if they're pushing too hard? Because like you said, it's different when you're pregnant.
Right. You're going to have like a shortness of breath. You're going to run out of breath easier because your lungs can't expand the way with the uterus coming up and pressing on your diaphragm. You're not going to be able to breathe as deeply as you did. So pay attention to that. When you find pains, slow down, listen to your body and respond to it. Don't push through that, as I said before. And just know your limitations. That is really important.
And I think the main thing is accept that your limitations are lower right now. Like I was saying earlier, I liked to do the HIIT workouts that made me feel like I was going to die. You actually can't do that when you're pregnant. You can't be pushing yourself that hard where you're like, I'm not even going to make it through this workout. But then you push through and you do. And it's amazing. You can't actually do that when you're pregnant. You can't be pushing yourself that hard. You've got to chill out, because you don't want to be overheating and you don't want to be like just out of breath, like, which is normally okay to push yourself that hard. And then another thing is hydration is more important. That's like a huge factor in pregnancy. It's so hard because you need to be consuming a lot more water. I feel like it's already hard for a normal person to consume enough water. And when you're pregnant, you need even more water. And when you are exercising, you need even more water. So drink a lot of water. Electrolytes could be good, I'm assuming. Is that okay? Can I recommend that?
Definitely. You have to look at the heat. You're not going to go on those big hikes when the temperatures are very high outside. You're not going to do hot yoga. You're not going to do those extremes. You want to stay away from extremes.
Okay.
Yeah.
So another one is that you should not be lying on your back flat for extended periods of time. That's applicable to sleeping at night, but also could be applicable to some types of exercise I'm trying to think. I lie on my back sometimes for exercises. I do weight training, so sometimes I'm on my back doing chest presses or whatever. I'm assuming short periods of time is totally fine, but you just need to be aware to not be flat on your back for too long. And then just to close, remember, any normal person should be doing a warm-up and a cool-down with a workout. And that is basically everything that's good for a not pregnant person is better and more important for a pregnant person. Is that safe to say? Can I just word it like that?
Yep. Yeah, you need to be careful with your stretching to take it easy. You need to wear good supportive shoes and have clothing that is conducive to what you are doing.
So we hope that this has helped you realize that you should be exercising. If you're watching this, you probably do exercise and you're just wondering, or maybe you don't, and we're encouraging you to really make that a priority for the next several months. It's going to bring so many benefits to you and help you in your upcoming labor, as well as your general health, your recovery, even your baby's health and how your baby develops. So it's worth the effort. It's worth the sacrifice if you feel like it's a sacrifice. And I think in closing, let's just say, remember, we do have that free birth class, How to Give Birth with Practically No Pain, where you can learn more about how to prepare for your upcoming labor and delivery.